Today's video is going to be on class 5 lesions. And what we have here is a couple different types of lesions. Let me go up to the very first one here. We've got your typical cavity, or this is a carious lesion, as they call it. And the class 5 is right down along the gum line. Okay, you can see in this example in the top picture, this is very evident. This has decay right there. Over here, this white stuff, that's some decalcification. Now, sometimes there's decay underneath those, and sometimes there isn't. And then over on this one, you can see this kind of rough surface, some brown areas here that could be stain or it could be cavities. That could be something for the dentist to determine with an explorer when they're doing the exam to see if this is truly a cavity or not. Down here, you can see kind of more of the same, various stages. This one's clearly a cavity, so is this one. This one has that decalcification again. But you can start to see some of this yellowish brown, just like what you see over here as well. And so that's what I'm saying. These guys up here, they sometimes are cavities and sometimes they aren't. If they already have decay or caries on neighboring teeth, there's a pretty good chance that's going to be a cavity as well. But if they have pretty healthy teeth all in all, and we see this along the gum line, we may not be as likely to call that a cavity simply because if we take in, account the patient's dental history. Okay. Let's go to this next kind of class 5 lesion. Now, this is a class 5 area that is not due to decay, but to the wearing away of enamel. And there's a couple different ways this can happen. Let's look at this top example. We can see that there's a very large area, and this also has recession of enamel, and part of the root structure is missing right here. Some of it's been kind of scooped out. We can see a little bit of it here, but hardly any here and here. So one might think, well, how did that get there? It could be from brushing too hard. That could be the case down here. Look at this. There's a whole series of them all in a row. All of this recession along with enamel loss. That could be, you can imagine a toothbrush going back and forth across all these surfaces. But that doesn't explain, a toothbrush abrasion doesn't explain why this one tooth and a little bit of that tooth have recession, whereas this one looks perfectly fine and that one looks fine. So it's not like they're just brushing really hard right here. There's something else going on as well. And what we found is, or at least there's a theory out there that says it could be due to their bite. If their teeth are hitting awkwardly, like right here, it could be causing those teeth to flex a little bit. And when they flex up here at the gum line, that actually can cause some strain and little bits of enamel come off of that area. So it is conceivable that this one tooth, and a little bit to some degree is this tooth, could be hitting a little bit funny when the patient chews on some food, or when they put their teeth together, that tooth might kick off to the side. And so they get this, what we call an abfraction lesion up here, where enamel is gone, not due to a cavity, and maybe not from brushing too hard, but from actual flexing of the tooth. Whereas here, I guess you could still have flexing of the tooth, or several teeth, but this could be due to toothbrush abrasion. We can also see in some of these teeth, not in this slide, but if it's located primarily just on the very back teeth, again, it could be the bite, or if it's located to one side or the other, again, it could be bite, or it could be gastric reflux. Someone could be gurgling up acidic fluid from their stomach into their mouth, little bits of it that can sit there when they're sleeping and cause erosion of the enamel right there as well. So there's a couple different ways you can get a class 5 lesion. You can get it from a cavity, from carious bacteria causing a cavity on that tooth. It can come from toothbrush abrasion, it can come from chemical erosion, or it can come from a traumatic occlusion. So there's different ways that you can lose enamel up at the gum line. Okay, so either way, we're going to have to fix them. Well, let me take that back. We have to fix these. We have to fix the ones that have got cavities. We have to stop decay where it is. But on these, it's a little bit more talking to the patient to see, is this causing them a problem right now? Now, it may cause them a problem many, many years down the road, but right now, are they getting sensitivity in that area when they drink cold water, or if they breathe in like that, if it still feels sensitive, then we might want to treat those. If they find they're getting bits of food, little bits of broccoli, getting stuck up here in these little crevices when they're eating, that could be a problem for them as well, a cosmetic hygiene problem. And so we can go in and fill these areas in with composite resin. In some cases, though, they could also go in and have the gum specialist, gum grafting procedure, actually bring the gums down or graft in a piece of gum tissue. That can be done as one option as well. If they have an area where, say, like here, the gum line's kind of going along and then all of a sudden it arcs way up, if you just put a filling in there, it's still going to have an area of recession. And unfortunately, this picture cuts off the gum tissue, so we can't see how much of that thick attached gum line is there. But if it's real loose, it might be better instead to bring the gums down. So a couple different ways to fix it is either gum graft or to fill it in with composite. How do we do that with the composite? Well, if there's a small area of decay or an abfraction, we would go in and clean it out. Whatever the decay is, it kind of makes this kind of semicircular or half moon um, design, or wherever the decay goes, that's what we're going to clean out. And then we put our composite in there. We can either patty cake it in place and cure it, but what we like to use in our office is a device similar to this. This is just a little clear cuff that we can put right over the tooth, and then we can cure right through this transparent plastic. And then that kind of gives us a good shape. Plus, it ensures that we've got a nice tight seal all the way around the perimeter of that filling. So this is the kind of filling technique that we like to use in our office. One more case. This is showing somebody who has some extreme areas of decay across several teeth. And you can tell that, and this isn't our case, this is one that we got off the internet, but just to kind of show you to the extent that some of this decay can go. I wish I would have shown a picture of the teeth after they got all the decay removed, but all we see here is the before and the after. But they did more than just place a filling up here. You can tell by looking at the edges of these teeth, they went ahead and put some kind of complete covering on these teeth. It's either going to be a resin veneer, a porcelain veneer, or it could have been crowns. Sometimes these areas of decay, even though we see it very clearly here, when we start removing the decay, it can actually go around the mesial or the distal of the tooth. And then when you're done with that, it's almost impossible to take a little cuff. You almost have to wrap all the way around the tooth, and that becomes very difficult to make sure you have that sealed off. So in those cases, we have to go to something that a lab would make the final product, and that would be either a veneer or a crown. I don't know what they did in this case, but it just kind of shows that these areas can be fixed. So class 5 lesions, again, cavities or due to caries, abfraction, erosion, or something wrong with the bite. Hopefully that's been helpful. Thanks.